Heartburn is a common discomfort that many people experience, often described as a burning sensation in the chest. It usually occurs after eating or at night and can be triggered by certain foods, stress, or underlying medical conditions. In this video, we'll explore the most commonly used over-the-counter medicines for heartburn, helping you understand how they work and when to use them. Whether you're dealing with occasional symptoms or frequent episodes, knowing your options can make a big difference in managing your health. Let's start by understanding what heartburn is and why it happens. Heartburn occurs when stomach acid flows back into the esophagus, irritating its lining. This reflux is often caused by eating large meals, consuming spicy or fatty foods, drinking alcohol, or lying down soon after eating. Other factors like stress, obesity, and certain medications can also contribute. Understanding these triggers is important because it helps you make lifestyle changes alongside using medication. In the next scenes, we'll look at the main types of over-the-counter medicines available to relieve heartburn. Over-the-counter medicines for heartburn are widely available and generally safe for most people. They fall into three main categories: antacids, H2 blockers, and proton pump inhibitors. Each type works differently to reduce or neutralize stomach acid, providing relief from symptoms. Choosing the right medicine depends on the frequency and severity of your heartburn, as well as any other health conditions you may have. Let's dive deeper into each category to see how they help. Antacids are the most commonly used OTC medicines for quick relief of heartburn. They work by neutralizing stomach acid, which helps reduce the burning sensation. Popular antacids include Tums, Rolaids, and Maalox. These medicines are best for occasional symptoms and act within minutes. However, their effects are short-lived, and they may not be suitable for frequent or severe heartburn. Next, we'll discuss how antacids are used and their potential side effects. Antacids are typically taken as needed, either in chewable tablet or liquid form. They provide fast relief, but should not be used excessively. Overuse can lead to side effects like constipation or diarrhea, depending on the ingredients. It's important to follow the instructions on the package and consult a healthcare provider if you need antacids frequently. In the next scene, we'll look at H2 blockers, which offer longer-lasting relief. H2 blockers are another class of OTC medicines used for heartburn. They work by reducing the amount of acid produced by the stomach, offering longer-lasting relief compared to antacids. Common H2 blockers include famotidine, Pepcid, and ranitidine, Zantac, though some have been withdrawn from the market. These medicines are suitable for people who experience heartburn more than occasionally. Let's see how H2 blockers are used and what to watch out for. H2 blockers are usually taken once or twice daily, depending on the severity of symptoms. They start working within an hour and can last up to 12 hours. These medicines are generally safe, but may cause side effects like headache, dizziness, or diarrhea. It's important to check for drug interactions if you're taking other medications. Next, we'll explore proton pump inhibitors, which are used for more persistent heartburn. Proton pump inhibitors, or PPIs, are the strongest OTC medicines for heartburn. They block acid production more effectively than H2 blockers, making them ideal for frequent or severe symptoms. Common PPIs include omeprazole, Prilosec, and lansoprazole, Prevacid. These medicines are usually taken once daily and may take a few days to reach full effect. Let's discuss how to use PPIs safely and their potential risks. PPIs are intended for short-term use, typically 14 days, unless advised otherwise by a healthcare provider. Overuse can lead to side effects such as nutrient deficiencies, increased risk of infections, and kidney issues. Always follow the instructions and consult your doctor if symptoms persist. In the next scene, we'll compare the three main types of OTC heartburn medicines to help you choose the best option. Choosing the right OTC medicine depends on your symptoms and needs. Antacids are best for quick, occasional relief. H2 blockers offer longer-lasting effects for moderate symptoms, while PPIs are suitable for frequent or severe heartburn. Consider your health history and any other medications you're taking. If you're unsure, consult a healthcare professional for guidance. Next, we'll look at some common brand names for each category. Some of the most popular antacid brands include Tums, Rolaids, and Maalox. These are available in various flavors and forms, making them easy to use. They are widely sold in pharmacies and supermarkets. Remember, antacids are for occasional use and should not replace medical advice if symptoms persist. Next, we'll list common H2 blocker brands. Famotidine, Pepcid, is the most widely used H2 blocker today. Ranitidine, Zantac, was once popular, but has been withdrawn in many countries due to safety concerns. These medicines are available in tablet form and can be found in most pharmacies. Always check for updates on safety and availability. Next, we'll highlight popular PPI brands. Omeprazole, Prilosec, and lansoprazole, Prevacid, are the most common OTC PPIs. They are available in capsule or tablet form and are designed for short-term use. These medicines are effective for persistent heartburn, but should be used with caution. Always follow package instructions and consult your doctor if you need PPIs regularly. Next, we'll discuss when to seek medical attention for heartburn. While OTC medicines are helpful for mild heartburn, it's important to seek medical advice if symptoms are severe, frequent, or accompanied by other issues like difficulty swallowing, weight loss, or chest pain. Persistent heartburn may indicate a more serious condition, such as GERD or even heart problems. Don't ignore warning signs. Consult a healthcare provider for proper diagnosis and treatment. Next, we'll look at lifestyle changes that can help prevent heartburn. Making lifestyle changes can significantly reduce heartburn symptoms. Eating smaller meals, avoiding trigger foods, not lying down after eating, and maintaining a healthy weight are all helpful strategies. Reducing stress and quitting smoking can also make a difference. These changes, combined with OTC medicines, offer a comprehensive approach to managing heartburn. Next, we'll discuss dietary tips for heartburn prevention. Certain foods are known to trigger heartburn, such as spicy dishes, fatty foods, chocolate, caffeine, and alcohol. Keeping a food diary can help identify your personal triggers. Opt for bland, low-fat meals, and avoid eating late at night. Drinking water instead of soda or coffee can also help. Next, we'll look at how stress affects heartburn and ways to manage it. Stress can worsen heartburn by increasing stomach acid production and affecting digestion. Practicing relaxation techniques such as deep breathing, meditation, or yoga can help reduce symptoms. Regular exercise and adequate sleep are also important. Combining stress management with medication and lifestyle changes provides the best results. Next, we'll discuss the importance of reading medicine labels. Always read the labels on OTC medicines carefully. Pay attention to active ingredients, recommended dosages, and warnings about interactions or side effects. Some medicines may contain ingredients that can cause allergies or interact with other drugs. If you're unsure, ask a pharmacist for advice. Next, we'll discuss potential side effects of heartburn medicines. Antacids are generally safe, but overuse can lead to side effects such as constipation, diarrhea, or changes in electrolyte balance. Some antacids contain aluminum or magnesium, which can affect kidney function if used excessively. Always use antacids as directed and consult your doctor if you experience unusual symptoms. Next, we'll look at the side effects of H2 blockers. H2 blockers are well tolerated, but may cause side effects like headache, dizziness, or diarrhea. Rarely, they can affect liver function or cause allergic reactions. If you notice any unusual symptoms, stop taking the medicine and seek medical advice. Next, we'll discuss the side effects of PPIs. PPIs can cause side effects such as headache, nausea, diarrhea, and increased risk of infections. Long-term use may lead to nutrient deficiencies, bone fractures, or kidney issues. Always use PPIs as directed and consult your doctor if you need them for extended periods. Next, we'll discuss drug interactions with heartburn medicines. Heartburn medicines can interact with other drugs, including blood thinners, antibiotics, and certain antidepressants. Always check for potential interactions before starting a new medicine. If you take prescription medications, consult your doctor or pharmacist to ensure safety. Next, we'll discuss heartburn in special populations, such as pregnant women and older adults. Heartburn is common during pregnancy due to hormonal changes and pressure on the stomach. Many OTC medicines are safe, but it's important to consult a healthcare provider before use. Antacids are generally preferred, while H2 blockers and PPIs may be used under medical supervision. Avoid medicines containing aspirin or sodium bicarbonate. Next, we'll discuss heartburn in older adults. Older adults may experience heartburn more frequently and are at higher risk for complications. OTC medicines can be effective, but it's important to monitor for side effects and drug interactions. Kidney function and other health conditions should be considered when choosing a medicine. Consult a healthcare provider for personalized advice. Next, we'll discuss heartburn in children. Heartburn can affect children, especially those with certain medical conditions. OTC medicines should only be used under pediatric guidance. Antacids are sometimes recommended, but H2 blockers and PPIs may be prescribed for persistent symptoms. Always consult a pediatrician before giving any medicine to a child. Next, we'll discuss natural remedies for heartburn. Some people prefer natural remedies for heartburn, such as ginger tea, chamomile, or chewing gum. These methods may help reduce symptoms, but are not a substitute for medical treatment. Lifestyle changes, like avoiding trigger foods and maintaining a healthy weight, are also effective. Next, we'll discuss the importance of hydration in managing heartburn. Staying hydrated can help dilute stomach acid and reduce heartburn symptoms. Drinking water throughout the day, especially after meals, is beneficial. Avoid sugary or caffeinated drinks, which can worsen symptoms. Next, we'll discuss the role of exercise in preventing heartburn. Regular exercise helps maintain a healthy weight and improves digestion, reducing the risk of heartburn. However, avoid vigorous activity right after eating, as it can trigger symptoms. Gentle activities like walking are ideal. Next, we'll discuss the importance of sleep position in managing heartburn. Sleeping with your head elevated can help prevent acid reflux and heartburn at night. Using extra pillows or a wedge pillow is effective. Avoid lying flat after meals, and try to sleep on your left side, which reduces reflux. Next, we'll discuss the importance of regular medical checkups. Regular medical checkups are important for anyone experiencing frequent heartburn. Your doctor can help identify underlying causes and recommend appropriate treatment. Early intervention can prevent complications and improve quality of life. Next, we'll discuss the risks of self-medicating for heartburn. Self-medicating for heartburn can lead to misdiagnoses and inappropriate treatment. It's important to use OTC medicines responsibly and seek medical advice for persistent symptoms. Overuse of certain medicines can cause side effects or mask serious conditions. Next, we'll discuss the importance of keeping a symptom diary. Tracking your heartburn symptoms in a diary can help identify triggers and patterns. Record what you eat, when symptoms occur, and any medicines used. This information is valuable for your healthcare provider and can guide treatment decisions. Next, we'll discuss the role of pharmacists in heartburn management. Pharmacists are valuable resources for heartburn management. They can recommend suitable OTC medicines, explain how to use them, and advise on potential interactions. Don't hesitate to ask questions about your symptoms or medications. Next, we'll discuss the importance of following up with your doctor. Following up with your doctor is essential if heartburn persists or worsens. Your doctor can assess for underlying conditions, adjust treatment, and monitor for complications. Regular follow-up ensures safe and effective management. Next, we'll discuss the importance of medication adherence. Taking heartburn medicines as directed is crucial for effectiveness and safety. Skipping doses or stopping treatment prematurely can lead to symptom recurrence. Always follow package instructions and complete the recommended course. Next, we'll discuss the role of diet and exercise in long-term heartburn prevention. Diet and exercise play a key role in preventing heartburn over the long term. Maintaining a healthy weight, eating balanced meals, and staying active can reduce the risk of symptoms. Combine these strategies with appropriate use of OTC medicines for best results. Next, we'll discuss the importance of avoiding trigger foods. Identifying and avoiding foods that trigger heartburn is essential. Common triggers include spicy, fatty, or acidic foods, as well as caffeine and alcohol. Keeping a food diary and making gradual changes can help. Next, we'll discuss the importance of portion control. Eating smaller portions can help prevent heartburn by reducing pressure on the stomach. Avoid overeating and try to eat slowly. This simple change can make a big difference in symptom management. Next, we'll discuss the importance of meal timing. Timing your meals can help prevent heartburn. Avoid eating late at night or just before lying down. Allow at least 2 hours between your last meal and bedtime. Next, we'll discuss the importance of avoiding tight clothing. Wearing tight clothing around the waist can increase pressure on the stomach and trigger heartburn. Choose loose, comfortable clothes, especially after meals. This simple adjustment can help reduce symptoms. Next, we'll discuss the importance of avoiding smoking and alcohol. Smoking and alcohol can worsen heartburn by relaxing the lower esophageal sphincter and increasing acid production. Quitting smoking and limiting alcohol intake are important steps in managing symptoms. Next, we'll discuss the importance of regular follow-up for chronic heartburn. Chronic heartburn requires ongoing management and regular follow-up with your healthcare provider. Monitor symptoms, adjust treatment as needed, and stay informed about new options. Early intervention can prevent complications and improve quality of life. Next, we'll summarize the key points from this video. To recap, the main OTC medicines for heartburn are antacids, H2 blockers, and PPIs. Each offers different benefits and is suited to different symptom patterns. Always use medicines as directed, make lifestyle changes, and consult your healthcare provider for persistent symptoms. Next, we'll discuss the importance of personalized treatment. Personalized treatment is key to effective heartburn management. Consider your symptoms, health history, and preferences when choosing a medicine or making lifestyle changes. Work with your healthcare provider to develop a plan that meets your needs. Next, we'll conclude with final thoughts on heartburn relief. Heartburn is a common issue that can be managed with the right combination of OTC medicines and lifestyle changes. Understanding your options and working with healthcare professionals ensures safe and effective relief. Remember to monitor your symptoms, follow instructions, and seek medical advice when needed. With the right approach, you can enjoy better health and comfort.